Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Marty Phillipps, who is the Director of the Family Care and Support Program for Oncology at RUMC. And I am also joined by two of our cancer survivors. We have Rosaria and Kelly, so thank you very much for joining me today. The month of June is often a cause for celebration, bringing warm weather, longer days, and summer vacations. June is also a special celebration for National Cancer Survivor Month. This month, we celebrate the resilient spirit of more than 18 million cancer survivors in the United States and honor the tireless efforts of doctors, clinicians, researchers, scientists, and therapists who have made survivorship possible. We also celebrate the families, friends, and communities who have provided steadfast care and support during their loved ones' battle with cancer. And at RUMC, we acknowledge a deep understanding that has evolved over the years and recognize the importance of psychosocial support in the journey toward recovery and survivorship. As previously mentioned, my guest today is therapist Marty Phillipps, who has been with RUMC for the last 53 years. So he's seen quite a lot. We'll discuss how RUMC's various behavioral health services have helped to empower cancer survivors. And just to give you a little background on Marty, Marty has graduated from St. Francis College, where he achieved his bachelor's degree and graduated magna cum laude. And he got his master's in clinical psychology from St. John's University in Queens. He's done various externship programs in family therapy. And as I mentioned, 53 years with RUMC, so he's seen it all. And I'd like to kick things off today and let our survivors share their stories. So, Rosaria, if you'd like to kick things off and share a bit about yourself.
Thank you. My name is Rosaria. I've been called also Rose, Sarah, many names. But I have a big story. I was born in Italy, and then I was raised in Argentina. Okay. And then when I was 22 years old, I came to this country. My background on education is from Argentina. I have some medical education, nursing, and I was very interested always in medicine. But I never thought that I was going to be part of whatever I learned during those years. 2019 was the first time I found out about my cancer. I have lung cancer. I never smoke, but I had the cancer. I found the right doctors that treat me the right way. Dr. Harris was my surgeon, is my surgeon. And among them is Dr. Forte, which is the one who really treat my cancer. I was in chemotherapy for a few months, and at this moment I am in remission. I continue with the certain therapies, and I can talk again. I'm still alive. It's my new me.
Yeah, exactly.
It's a new me because there was a point in my life that I didn't want to talk to anybody. I didn't want nobody to know that I was sick. I didn't want nobody to come and see me. But then I have this gentleman here calling me, and they say, you had to stay with us. Finally, one day I said, okay, let me answer him, and I did. He introduced me to Kelly and another group of people that they are not here right now. And somehow they invited me to go to their home, actually. Wow. I was very happy after I started talking to Marty. He made me said what I feel. I didn't have to lie. I didn't have to fake that I wasn't feeling good. I had to say the truth, the way I was going. Chemotherapy, it was hard. It was very hard for me. But I went through with their help. I call them my angels. Yeah. And all the people that I meet from now and I met before, they are angels because my life hasn't been easy. But I'm here.
The power of the support of a group, I'm sure, has made going through such a challenging time in your life, having that extra support is a beautiful thing.
I had the support of my family also, which is very important. It hasn't been easy, but every day I feel like I'm talking a little bit more. I can give advices, right, to other people sometimes. And I feel like, oh, well, I'm still alive.
Mm-hmm. And I'm sure that
And
you
here I
learn,
am.
you know, from other group members and that they learn from you. And it's just a beautiful support system to have. Now, how long have you been a part of Marty's group?
About 3 years maybe by now.
3, maybe 4 years long.
No, not really 4 years. I don't know. It's just that 3 years that I can talk, maybe.
Yeah. Okay.
Maybe before was a little different.
And how many people are a part of the group in all?
We have about 4 people
Okay.
in total. Not many people avail themselves to the group. I think part of it is that they've had enough of the treatment, so they think that this is an extension of treatment that they may not need. We don't call ourselves a cancer support group because we're not supporting cancer.
Yeah.
We call ourselves a healing team because Rosaria and Kelly, the others, they help each other. They heal each other.
During this treatment that I had, and I was happy, that I knew them, I developed an aneurysm in my brain. It was, in the beginning, I thought it was nothing, but it was a big thing. So it's my second time that I'm alive again. And with their support, I'm here.
You are. That's
I'm different. My hair is different. I'm happier, and I'm still alive.
That's the most important thing.
What did you say to me a couple days ago about possible recurrence of cancer?
Yes.
You said something that was
something funny.
just so simply lovely.
Because I had so many things in my life through since the day I was born. I asked the doctor to get at my aneurysm.
Okay.
And I said, is any possibility that I get again another one, that I get cancer again and all that? So he looked at me and he said, Rosaria, with your story, anything can happen, but be happy that everything worked out.
Yeah.
So I'm not free from nothing, but I'm okay, and I'm going to fight it. And I have those people to help me. That's it.
And you also said, whatever happens, I will accept.
Now, oh, yes. This is the point that I am at this moment. I accept everything. It's bad? Oh, okay, I accept it. It's good? Very good, I accept it. So I had to be positive, and I think I am.
I think that's a beautiful mindset.
I am.
Because, like you said, especially when it comes to anything medical, there's just certain things that are outside of our control. And, just to be able to keep that positive mindset and to be able to accept, whatever.
The worst part is the depression. When depression hits you and you fight with depression and you think, oh, what happened to me? I was never like that. And I remember many, many years ago, I read a book about depression. And they said, depression is a house. And if you are welcome in that house, you can beat depression. And I am in that house, and I'm beating depression because, of course, some days situation is bad, Some days it's getting better. Yeah. Bad news, they are all over, especially today. But I accept it, and that is my story at the moment.
That's beautiful. Thank you for sharing.
Thank you.
Kelly, would you like to tell your story?
Okay, my name's Kelly, like Rosaria. I'm in the medical field, too. I teach medical assistants.
Okay.
I am an ovarian cancer survivor, and I ended up at Dr. Ina Tubman's office, and she's the one that admitted me to RUMC, and that's where my journey began with Dr. Sorora and then Dr. Florenza. They only gave me like 6 weeks to live when I was in the emergency room, and I'm a real devout faith believer. And I said my prayers and whatever and have you be. And the one thing that I came out with it is even though you have a diagnosis, the diagnosis doesn't define you. You define the diagnosis. Right. And I moved forward positively. I went to faith healing masses with my faith base. Then I found the organization Teal, Tell Every Amazing Lady about ovarian cancer, and focused on that. And how I ended up in Marty's hands, poor Dr. Florenza, he was examining me, and I had a couple little expletives come out of my mouth. And I said, when am I going to stop feeling like a cancer patient? I don't want to be underneath the covers and being paranoid about life. I want to live. And he turned around and he's like, I have the perfect person for you. And that's how I ended up in Marty's group.
Wow, I love it. That's great. It's the power of a positive mindset, right?
Yeah.
Mm-hmm.
Now, how long have you been in remission for?
6 years.
Beautiful.
6 years, yep.
That's great. And you've been part of the support group for how many years?
I think about 3.
About
Three,
yeah.
three, 4.
Okay.
Like 3.5 going on 4.
Yeah.
Because it was around my 2-year mark. Because, you know, when you're a cancer patient, you go from, you have a relationship with a doctor, your life is just altered completely. Yeah, monthly, you have a monthly visit. Then you go to every other month. Then you go to 3 months. Then you go to 6 months. And you can't wait to get like once a year.
Yeah.
And when you get to the 6 months, it's like you feel like you're breaking up with your doctor.
It must feel that way.
It's true.
When you're going so frequently.
It's like you're being pushed out of the nest and you have to learn how to live again, but you're learning to live with something that you've conquered. And through that, other dynamics happen too. And the theories of people who have cancer, I had one person say to me, you know, well, I thought you brought this on to yourself. And I was like, well, yeah, I went to the grocery store and I had 2 coupons. Buy one, get one free. Why not? But you learn that people's fear of cancer, and my fear was my greatest fear. It was to have cancer. And now it's my greatest sword in life that I battle through life. If I can get through this, I can get through anything.
It shows the strength of your spirit and your will and your determination, of course.
Thank you.
Absolutely. And I mean, but like you just touched on, I mean, it has to be such a transition for both of you, for any cancer survivor, to go from these consistent appointments. Like you said, they're weaning down. And then when you're done, you're just done. You know, that I could see how that could leave a bit of an unsettling, you know, like who do you have for support now? All right, my cancer is gone.
Yep.
What's the next step? Do I just go for annual follow-ups? You know, that's...
Yeah, and part of that is the process of staying healthy in recovery and healing. But you just said something very important, Kelly, and that is that at the end of treatment, because you're well, you know, you think that you lose your treatment team. But at RUMC, you really don't. You know, your treatment team is part of your family. You're part of they're part of you. But when treatment is over, with our program, the family doesn't end; it continues, and that's where family care and support comes in. That you stay part of the healing community that RUMC is.
Yeah, absolutely.
Yeah. I was told that. Why do you want to see the doctor every month, every week? You are looking to find something wrong. I said, in the contrary, I'm looking to make sure that I'm okay. And this is the part that they don't understand.
Being proactive.
But I want to be sure that I'm okay, because in case I'm not, I have the right team with me.
It's basically facing your fear by being proactive.
Yeah.
Exactly.
And others avoid that. And they feel avoiding it, denying it, not talking about it. It's not going to happen.
Doesn't make the problem go away. Exactly.
We started family care and support in 2008 on a grant from Staten Island Trust, Staten Island Foundation. And we started it based on a book that I had read. It was called Strong at All the Broken Places, Voices of Illness, A Chorus of Hope. And I brought that to our administration and said, we got to do this. Yeah. This is family systems medicine, and this is how the program started. But the theme of the book was following patients with long-term and sometimes terminal illnesses over a course of 2 years. And you got to begin to understand what life is like for them on a day-to-day basis. Not just treatment, not just healing, but the struggles that a person goes through. And the outcome of the book, the conclusion of the book, which, by the way, was based on a grant for Harvard medical students, so to help them humanize their care. You're not just a diagnosis. Yeah. You know, you're a whole person with a family.
Of course.
And one of the conclusions of the book was that the patients all said that what helped them was having empathy for others who may be in a worse situation. And it also, either because and in spite of, and or in spite of their illness, it gave them dignity. And it turns out that they, like you ladies and the others, other survivors, you're the healers. You're the exemplars. You teach all of us how to live with dignity. You teach your families. You are the doctors of your family. And you also, I think, are exemplars to we in the healthcare profession.
Thank you.
Yeah.
No, I absolutely think that, and especially that you both have a little bit of medical backgrounds, it's, helped you.
This is the scary part.
Yeah.
We're the worst
Yeah,
patients.
it's true. Because you read about it, you know more about it, and then you say, well, where am I standing here? Which part I am?
Yeah.
I had to go. I had to survive. It's okay. I can't swim in the waters, but I can swim into this. I can come out. It's a little hard, but...
Are support services offered to family members as well in this process?
Yes, and we set up the program both for patients in treatment and survivors to be available to the whole family. It's individual and family support. So sometimes I will meet with individuals, couples, whole families. Sometimes when individuals can't get to me because they're either in rehab or homebound, I'll go to them. Yeah. We'll do home visits. So and it's a continuous process that we're available to the individuals and families, even following treatment.
How frequently do you meet?
We meet once a week.
Once a week. Once a week, and we have the expert on putting everything together. Because it's true. I will not be able to do it, but we do FaceTime.
Okay, very nice.
We do Zoom when COVID came.
Yeah. Power of technology, right? You can't make it, you zoom in. That's great.
Yeah, but at South Avenue, we have a little cluster of a park there. So when the weather's nice, we go outside and we meet outside.
That's nice.
Sometimes we have lunch.
Yes, we have lunch.
Sometimes we have, little drink.
That's great. Yeah, you got to live it up. Right. Make the meetings.
And I tell you what happens. Very often when the group meets, we share day-to-day things, what's going on in our families, sometimes the conflict, sometimes the good stuff. But it's more often than not just very ordinary stuff. But once in a while, when someone really is in that house of depression, or is struggling, we get really down into it about what healing is about, what the meaning of life is,
how to deal with that situation.
And how to deal with those situations.
Because,
But you can't have that if you're just meeting and you're being very clinical all the time, or you're being very pedantic. You can't, that's not helping people. And they'll probably get to it later, but when we talk about trauma, the single most healing factors are consistent acts of kindness, both giving and receiving, having good relationships. And that replaces the trauma of illness or whatever other trauma that happens to an individual. It's good relationships and it's kindness to one another. 100%. And it's giving back.
Because sometimes you don't know, you feel, what happened at home with me, And then I see it in one way, I am destroyed or whatever. And then Kelly comes and she has another story. Marty will say, no, don't think like that. Things are, and you think about it and say, oh, wow, maybe they are right.
Yeah.
And somehow you change.
It's a way to redirect your thought process.
That's exactly right. It's redirecting your thought, redirecting your thinking, redirecting your beliefs, positive and realistic at the same time.
Yeah. And I was surprised that when I say something, they said, oh, maybe she's right. Oh, that was, for me, was a big thing.
Yeah.
So whenever they talk, it's important to me.
Of course.
Because they know me now.
They know you personally and how,
And I think when you're a cancer patient, the reality of life changes. Your perception of life changes. And when people haven't gone through that experience, and then they're trying to experiencing something else with you, like sometimes you just don't mesh.
Yeah.
Because you're on two different levels. And what may worry one person, you're like, wow, I'd be grateful for that.
Yeah.
You know?
You're in different parts of your journey, and yeah, of course.
Exactly. So that's where I think sometimes the conflicts within as a cancer patient, and when others try to stress and push things onto you, that's when it comes becoming conflicting. And that's where you can't go down the, I call it the crazy train, the negative train, you know? It's like a potato chip. One negative thought, it's so much easier to think negative than to think positive.
It is.
You know, harder to smile than
It's true.
to frown.
Yeah. That's true. Okay, so for other survivors or people who are currently, battling cancer, what sort of techniques do you recommend to reduce anxiety and the stress that they might be feeling? Is it just this redirecting of the thoughts to try to have the positive mindset? Is there other techniques that you like to implement?
When I think, when I think of someone going through cancer treatment, their whole lives revolve around doctor's appointments, treatment, chemotherapy, managing and handling the effects of chemotherapy or radiation. And what I guide them into thinking is, what can you do in the course of your daily life that's going to give you some peace of mind, some respite, some enjoyment, some gratification, some relief, some relaxation, and to make that part of your appointment schedule.
Okay.
And it doesn't have to be something big. It could be either driving to or being driven to a park, the boardwalk, sitting down with a cup of tea, a cup of coffee, and enjoying the moment. And depending on what they physically could handle or what, in fact, gives them enjoyment,
To focus on that.
And to focus on that. And to also understand that they may be feeling lousy, but they're doing the best they can.
Yes.
And that's okay. And that's healing. That's health.
Go to Willowbrook Park and see the ducks there.
Yeah.
That is.
It's a nice,
kind
peaceful thing to do.
Wow, it's nice.
It is. It's beautiful. We're blessed to have beautiful parks on this island and many of them. So we have good outlets here to get outside and enjoy nature for sure.
But the way Marty handled us, I don't know. He always had the right word for whatever you are going through.
Okay.
I feel that way. I don't know. Maybe it's not. I'm sorry.
No,
but
No,
I
it
feel
is.
it's that way.
Most of what I do is listen to the two of you and not relabel it, certainly not clinically, but as a normal feeling. Actually, we set up this group, and Dr. Folenza and I said that we got to structure the family care and support program not clinically. Because the last thing people want to hear after they receive a diagnosis of cancer is, well, you're depressed and you're anxious and now you got to see a psychiatrist. Stop it. The depression, the anxiety, the distress is normal.
Yeah.
So let's normalize it from the point of view that this is something that's expected, accepted, and we'll work with it. Not as pathology, but in the normal course of acceptance and healing. But when someone is, in fact, clinically depressed or anxious, then I will refer them to 1130 South Avenue Behavioral Health for medication or actual therapy.
Yeah, no, that's great that we're able to offer all of these services too outside of the support group.
That's right.
People don't have to leave the island. That these things are accessible right in their own backyard, and it's good to have that support. So, if you want to just go back to the empathy and giving to others, you had mentioned this ASYV. If you want to touch on that a little bit.
Yeah, it has it doesn't refer specifically to cancer, but it a reference to trauma healing.
Yeah.
ASYV is Agahos Shalom Youth Village. It's a healing and education community that we have in Rwanda where I go to and where I've been in charge of health and wellness for the past 10 years, that was set up after the Rwandan genocide, which is actually 30 years now, this past month and this month. And we have 500 kids who are with us for high school. And although the kids were initially victims of the genocide, or parents were, they now are in the most traumatic and destitute areas and lives, have the most destitute and traumatic lives in Rwanda, and they heal. They're with us for 4 years and they heal. And we ask the kids what helps. We provide them with a loving, healing community that helps them to be responsible for their lives. But the kids will tell us the single most thing that helps them is that we teach them how to give to others. And my point is that that kind of healing from that intense and catastrophic trauma, you know, what helps them more than anything else? It's the ability and the actuality of giving to other people, that they're no longer the victims of trauma or cancer, but they are now healers themselves, and they give to others. There's a lot of literature that shows that repetitious acts of kindness, giving and receiving, that I referred to earlier, is more healing and more therapeutic than 50-minute psychotherapy sessions. And that's right, more than anything else. And I'm absolutely convinced of that. So even with people in therapy, what's the goal of therapy? Exactly what I just said. Not to talk about their illness all the time,
Right.
but sometimes they have to, you know. But when they talk about it, who's listening? Someone who's caring and compassionate and could guide them to what to do about it. And as I said earlier, because of or in spite of their illness, to develop a new life or a life of dignity. Whether it's a mental illness, whether it's trauma from the village, as I spoke about, or whether it's cancer. And that's the healing process. So survivorship is not just a word. And it's not just, well, what's I'm going to do on my bucket list. Healing is hard work, but it's rewarding work. And you can go on the trip that you always wanted to do, you know, on your life, and God bless you, go ahead. But when that trip is over, what are you going to do and resume in your life? When you're giving to others and you have you're living a life of dignity and love for one another and healthy relationship, that's ongoing. That continues when you're off the plane and off the boat.
Would you say that there's a specific issue that you hear most commonly in these sessions, that people have fears, or is it?
That's a good point. When a person goes into survivorship and they go on with their lives, always in the back of their mind is the fear of reoccurrence. But this could happen again. Now, a lot of people have a very healthy attitude about that, which is part of the healing, which is that, well, as Rosaria, you said earlier, if it happens, I'll deal with it.
Right.
You know?
I accept it.
Some people sometimes go on with their lives, but when they have an opportunity to speak more at length, it's that fear that's lurking there. And so it may activate them to do something that may be reckless or careless or pretend that, well, if it happens, so what? I'm not going to take care of myself, you know. So they get cavalier, perhaps. Call it denial, you know. It's not denial. It's running very quietly, you know. But they need to understand that you could talk about what your concerns are, what your fears are, what's the probability that it would happen. If that is your concern, have ongoing consultations and meetings with your doctor. Monitor, you know, but also know what you need to do to live a healthy life as best you can, you know. But certainly it's an opportunity to talk about it in a calm and caring environment. And that may or may not be therapy. With our group, we don't call it therapy. We call it, let's have a conversation. That's what it is.
That's great. And I mean, do you encourage your group members to increase their physical activity? Do you talk about anything like diet related with that affecting how they're feeling?
Sure, nutrition is a big part of it. Exercise, whatever that may mean. It may mean going to the gym and maybe taking a walk.
Yeah.
You know, there's a whole range.
Depends
Things
on
that
the
you could do.
situation
Of course.
Depends on who you are, your situation, what your appetite is for. You know.
Absolutely. Well, I would like to thank you all for joining me and for sharing your stories and for what this group, has meant to you personally. And that I hope that, this reaches out and touches others and gives them the strength and the comfort to know that they can join something like this too for additional support on their journey as well.
Rosaria said something earlier, and Kelly backs it up with notes to everybody. and that is that Rosaria, Kelly, and the others there truly guardian angels to one another. They are healers, to one another and to others. They're exemplars of being individuals, people of dignity and health.
And kind of feel that somebody...
You ladies are God's gifts.
Yes,
You're our
having
gift.
a problem. And we talk,
If we didn't have you, we wouldn't have found one
be
another.
here. That's true. So it's a nice
Thank you
group.
for that.
It's true. It sounds like you're all very lucky to have found each other and support each other on your journeys. So for everyone listening, if you would like more information about the behavioral health services that are offered at RUMC, you can call 718-818-6132 or visit rumcsi.org. Thank you so much for joining us once again. That about does it for this episode of RUMC Connections. I'm Meredith Gaskins.